Hello, my name is David Nabarro, and I would like to welcome you to this briefing about the Imperial College Master's course in Patient Safety. A bit about myself. I actually work at Imperial. I'm co-director of the Institute for Global Health Innovation. I also work as WHO's Special Envoy on COVID-19, and I am setting up a program of dialogues on the future of food systems to prepare for a food systems summit that is taking place later this year. Actually, I became involved in the issue of patient safety when I was working as an Assistant Director General at the World Health Organization in 2002. That was when a number of countries, but with the United Kingdom strongly in the lead, came together to ask the Director General of WHO to initiate an initiative on patient safety. And that's because of the growing evidence that healthcare is associated in some cases with harm to those who are being cared for. 1 in 10 patients, according to some reports, are subject to an adverse event while receiving hospital care. But if we look at what happens in other aspects of healthcare, the impacts may be even more frequent. And the estimate for lower and middle income countries is suggesting an even higher proportion of patients are actually harmed during medical care. And overall, 60% of deaths in lower and middle income countries are reckoned to be associated with conditions that are amenable to better quality hospital-based care. And we see examples of this even now. Just 2 weeks ago, I read a report of an elderly patient who was confused, who accidentally had the wrong leg amputated in a hospital in Austria. And the patient is unfortunately going to have to go through a second procedure to amputate the other leg, the one that should have been amputated in the first place. This is not necessary. And many people feel that this is just not acceptable. And that's why it is absolutely essential that we systematically understand why patients get harmed during healthcare and what can be done to address the challenges, particularly given that safe care will be essential in achieving universal health coverage. Now, there are challenges and we understand those, and that's why at the Institute for Global Health Innovation, we are seeking to try to help shape global health policy in relation to patient safety. We are involved in Patient Safety Translational Research Center, which is aiming to develop patient safety in the National Health Service and internationally through novel research and the translation of evidence-based best practice into different organizations involved in healthcare, as well as to professional groups to make sure that clinical partners, whether they are medical or nursing or in other professions, are well able to introduce protocols that increase the likelihood that patients receive the safest possible care. And that's why Imperial is working closely with the Global Patient Safety Collaborative, which has been set up with support from the World Health Organization to bring patient safety higher up the agenda. And that's where the Center for Health Policy in our institute has been a partner in the World Innovation Summit for Health to disseminate the best evidence-based ideas and practices in global healthcare. Now, I actually think that coming to join us at Institute is going to be good, not just for you, but also for others with whom you work. Because at Imperial, what we're trying to do is to bring together leading academics in order to establish the best kind of impactful applied research in patient safety, doing it in ways that engage with patients themselves as well as with their carers, and making sure that we approach patient safety as a systems issue and one where we take account of the fact that many different groups are involved in patient care, and one of the biggest challenges is to find ways in which they can work together to get the best possible outcomes. In doing this, we engage with patient safety advocates who help us ensure that the research that we do can actually read across into policy. And we engage with many organisations across the globe because this is one area in which collective action is valued and makes such a difference. And perhaps you can hear it in my voice. We're passionate about using our expertise to enable global leaders to become change makers in patient safety. And that's why we've established the Masters in Patient Safety that's been launched in collaboration with Bayer Pharmaceuticals. This course is open to UK and international applicants. It's fully online, which means there's a flexible approach to learning and responding to emerging needs. It also aligns closely with the World Health Organization's curriculum on patient safety, in which we are closely involved. And the course is delivered through a combination of online learning, group learning, and live virtual teaching sessions from world-leading experts in the field. We hope that the course will actually have a number of key benefits, and we evaluate our work very closely according to these criteria. First, are we offering best practice frameworks that are drawn from healthcare practitioners who are actively involved in care around the world? Secondly, are we offering real-world insights? And can we present case studies that actually connect directly with our students? Can we enable our students to have opportunities to improve their skills and become future patient safety leaders? And lastly, are the live teaching sessions that we offer ones that will really make a difference? We're continuously evolving, and we want you, please, to come and join us. Find out more. And then, if from us you hear some things that really make you feel inspired, please come and join us and be part of the community of advocates for patient safety throughout the world. You can make a difference, and we'd love to join with you in making that happen.